In this video, we're breaking down 14 sneaky symptoms your body could be throwing at you that could mean your blood sugar is too high. In fact, many people walk around with elevated glucose levels for months, even years, without realizing it, even if you haven't been diagnosed with diabetes. From unexplained fatigue and brain fog to frequent infections and subtle changes in your skin, these signs can be easy to ignore, but they're your body's way of waving a red flag. We'll also go over what you can do, evidence-based steps to help bring your blood sugar back under control. Let's get started, because early action can make all the difference. Number 1. Excessive urination. When blood glucose level is high, the kidney excrete glucose in the urine to compensate for the excess glucose in the blood. This makes you urinate frequently. 2. Excessive thirst. Excessive thirst goes hand in hand with excessive urination. The thirst you experience is your body trying to compensate for the extra fluid lost in your urine. Excessive thirst can increase the risk of dehydration. Being dehydrated causes nausea, dizziness, and headache. 3. Excessive hunger. Your body turns the food you eat into glucose, a type of sugar that your cells use for energy. However, for glucose to enter your cells, insulin is needed. If your body doesn't produce enough insulin, doesn't produce any at all, or if your cells become resistant to it, glucose stays in your bloodstream instead of being absorbed. As a result, your cells don't get the energy they need, which can leave you feeling unusually hungry. Extreme fatigue. Extreme fatigue happens when your body can't use glucose for energy due to a lack of insulin. Without enough insulin, glucose stays in your blood instead of fueling your cells, leaving you feeling tired and sluggish. Number 5. Unexplained weight loss. If this happens without changes in diet or activity, it can be an early and serious sign of high blood sugar. When the body can't use glucose for energy, it begins breaking down muscle and fat to meet its energy needs, which causes unexplained weight loss. Number 6. Blurred vision. High blood sugar can affect your vision by changing fluid levels in the eyes and causing swelling in focusing tissues, leading to temporary blurriness. When blood sugar returns to normal, vision usually improves. However, over time, high blood sugar can damage the small blood vessels in the eyes, leading to diabetic retinopathy. This can start with trouble seeing clearly and may progress to floaters, vision loss, or even blindness. Number 7. Skin changes. Hyperglycemia can cause a number of skin changes. Dry or itchy skin, frequent skin infections, delayed wound healing. Number 8. Acanthosis Nigricans. This is a skin condition marked by dark velvety patches, commonly linked to insulin resistance and type 2 diabetes. However, it isn't always a direct sign of diabetes, as it can also be caused by other factors like obesity or certain medications. Number 9. Impotence. High blood sugar can eventually cause nerve damage in the genital area. In men, this may affect the nerves needed for maintaining an erection. Hyperglycemia is also linked to sexual dysfunction in people with female reproductive systems, though more research is needed to fully understand this connection. Number 10. Reduced fertility. Trouble conceiving can be a sign of high blood sugar, which may lower fertility and affect egg quality. Keeping blood sugar levels in check is crucial before and during pregnancy, as early high levels can increase the risk of miscarriage or birth defects. Research also suggests that high blood sugar may harm sperm count, movement, and quality, impacting male fertility as well. Number 11. Tingling and numbness. Numbness and tingling in the hands and feet can result from poor circulation caused by high glucose levels. This is especially common in people who've had diabetes for many years, affecting about half of those with the condition. Over time, consistently high blood sugar can also damage the nerves, a condition known as diabetic neuropathy. The most common form, peripheral neuropathy, typically affects the feet, legs, and sometimes the hands and arms. Number 12. Recurrent infections. High blood sugar can weaken the immune system, making the body more prone to infections. It also creates an environment where certain bacteria and yeast thrive. As a result, people with diabetes are at higher risk for infections, especially in the respiratory and urinary tracts. Number 13. Brain fogs. High blood sugar can cause brain fog, making you feel forgetful, unfocused, and mentally slow. Your brain isn't getting energy properly, leading to that cloudy, drained feeling. It's a common but overlooked sign. Managing your blood sugar can help clear your mind and restore focus. Number 14. Crankiness or behavior changes. High blood sugar affects mood, but many people with diabetes report mood and behavior changes with shifts in blood sugar levels. A 2020 literature review found a link between sharper rises in blood sugar after meals and more negative mood symptoms. However, researchers noted the evidence was limited and called for more high-quality studies to better understand the connection. Now let's see how we can save ourselves from high sugar levels. Generally, a person can delay diabetes, but if you have a family history or are living an overly inactive life and consume a high carbohydrate diet, you will be captured soon. But don't worry, the following will help you. Number 1. Checking your blood sugar levels regularly. A normal fasting blood sugar level is between 70 and 99 milligrams per deciliter, 3.9 to 5.5 millimoles per liter. A level between 100 and 125 milligrams per deciliter, 5.6 to 6.9 millimoles per liter, indicates prediabetes, and 126 milligrams per deciliter, 7 millimoles per liter, or higher on 2 separate tests indicates diabetes. Number 2. Exercising regularly, at least 140 minutes per week. This will cause the body to utilize the excess carbs, leading a healthy and active life while lowering your blood sugar levels. Number 3. Eating a balanced diet, avoiding rich in sugar foods and drink. This will help your body to regulate sugar levels on its own. Plus, if there isn't excess to burn in the body, a lot of the symptoms wouldn't even be here. Number 4. Getting routine checkups with healthcare providers. HbA1c should be checked 6 monthly or once a year. This will be easier for you and your healthcare provider to keep you under control, and staying under the range of 5.5 is a good idea. Number 5. Visit an ophthalmologist or optometrist can help you monitor any eye problems. So there you have it. 14 sneaky signs your blood sugar might be running high. The key? Don't ignore the little things. Your body always sends signals, you just have to listen. If any of these signs sound familiar, talk to your doctor, check your levels, and start making small changes today. Your future self will thank you. And hey, drop a comment if you've experienced any of these signs. You're definitely not alone. Don't forget to like, subscribe, and hit the bell so you never miss videos like this.